Good afternoon, everybody. My name is Gunther Schertz. I'm the Age Management Consultant of Cutis Medical Laser Clinics, and I'm here today with the Medical and Scientific Director of Cutis Medical Laser Clinics, Dr. Sylvia Ramirez. Dr. Sylvia, thank you for joining us for the interview.
Thank you, Gunther.
Today we want to talk about age management, and I want to start with the main topic of what is age management and why is it so important?
Age management is a term that is used to manage or delay the indicators of aging in order to prevent premature disability and death. The most important outcome of age management is a better quality of life, a better sense of well-being, not just living longer, but living better. And this is exactly what we want to achieve with our patients. Most commonly, an individual will come to us with very common complaints such as an increasing waistline, feeling very tired, lack of focus, low libido, and just having low vitality. And really, more importantly, one of the components of age management is preventing chronic disease, which is on the rise and is a major issue as we get older. For example, heart disease or cardiovascular disease is the leading cause of death in the world. Every year, the combination of heart disease and stroke exceeds infectious diseases as the cause of death, not just in other countries but also in Singapore. In addition, in Singapore, every day 15 people die from some heart condition, and 1 in 4 people aged 40 and above in this country has at least one chronic disease. And what's most important to understand is that oftentimes many aspects of these diseases are preventable, as these are lifestyle-related conditions.
Fascinating. Dr. Sylvia, you mentioned that common issues relating to aging, such as feeling exhausted, increasing waistline, and chronic diseases. How can Optimagenics, the age management program of Cutis Medical Laser Clinics, help with these issues? What makes Optimagenics different?
Optimagenics is based on the latest body of scientific knowledge in age management medicine. And what it does is it combines aspects of care including endocrinology or hormonal management, the latest in nutrition and exercise science, and combining that as well with an improvement in one's mindset. The combination of these elements have shown to improve the common issues related to aging, such as increasing physical and sexual vitality, improving sleep quality, decreasing body fat, and many more, including reducing the incidence of many chronic diseases. We have also been trained in the United States by Optimagenics, which is currently one of the leaders in age management medicine, and we're very excited to bring this program to managing age here in the Asia-Pacific region.
Interesting. Dr. Sylvia, what is the approach of Cutis Medical Laser Clinics to aging? What is the main focus for Optimagenics?
I think, as you understand from what I've said, the most important factor is lifestyle. And one of the factors we work with our patients is to modify lifestyle. The other key aspect is it's all about prevention. It's always better to prevent a chronic disease rather than to manage it. A third aspect is that, in fact, to a certain extent, we can manage aging. We can age better and live longer. Finally, one of the aspects that is important for our Optimagenics program is that normal values, whether it's for hormonal levels or other metabolic factors, are not necessarily optimal for how we can feel and live better.
So then what are the goals of Optimagenics? What do we want to achieve?
Optimagenics' goal is to improve the quality of life of our patients. This is the most important factor. This is what we do even with our aesthetic treatments at Cutis Medical Laser Clinics. For Optimagenics in particular, we want our patients to experience the following. The first is to decrease the onset or the occurrence of age-related chronic diseases such as high blood pressure, diabetes, heart disease. Second is to increase one's physical and sexual vitality. The third is to improve overall mood and well-being and give you back energy. We want to decrease body fat and increase muscle tone. And we want to have an overall improvement in one's mental performance and mental acuity.
You mentioned that lifestyle is key. So why is exercise and nutrition not enough?
Often, exercise and nutrition can do the job, and it is actually 70 to 80% of the battle. However, key hormones are important in ensuring normal metabolic balance, and when we're missing some of these hormones, it reduces the effect or impact of even the best nutrition and exercise, especially as we get older. If you think about it, hormone replacement, if done correctly, with the proper risk-benefit analysis for every patient, provides the fuel to the fire. Furthermore, suboptimal levels of hormones such as thyroid hormones, testosterone, whether for men and women, among others, contribute to increased weight gain, fat deposition, especially in our stomach area, and increased risk of cardiovascular diseases.
I know that Cutis is very focused on proven treatments and US FDA cleared treatments and services. What are the supporting studies relating to Optimagenics?
The entire Optimagenics program is in fact based on evidence-based medicine, the latest scientific body of knowledge from diverse disciplines such as exercise and nutrition science, hormonal management and endocrinology, general medicine, and even hypnosis. In all of the studies, in all of our programs, the studies have shown how to decrease the risk of age-related diseases, increasing physical and sexual vitality, improving sleep quality, improving your muscle tone and decreasing your fat, sharpening your mental skills, and overall improving your self-esteem.
What are now the specific elements of the Optimagenics program? What can a patient expect coming to Cutis and wanting to go through that Optimagenics program?
There are 4 key elements of Optimagenics. The first is a customized exercise program, and so what we do there is we make sure that we design a program that suits your lifestyle and your particular body image or body shape. The second is an individualized nutrition program and medical grade nutraceuticals. The third, based on blood tests as well as medical history and other forms of assessment, we design a personalized hormone optimization program. And the last and underappreciated component is the need to improve one's mindset. Oftentimes we get off the track with our diet because of emotional eating, and that's one of the aspects that we would like to help with.
Interesting. You mentioned the personalized hormone optimization. How safe is that?
In any treatment, whether it's giving an antibiotic or doing a laser treatment, should be individualized with a review of risks and benefits for each patient. Done appropriately, there's minimal downside to hormone replacement therapy, but we need to make sure that the particular patient is not at risk for certain conditions that certain hormonal therapies may place one at higher risk for.
Okay, now I'm sure the patients want to know how quickly they can see results in their program. What's the typical duration of people able to see the results that they're looking for?
This really depends on the age that a person enters the program, but in addition, it depends a lot on the degree of motivation. There are various factors, every individual is different. Most people, however, will notice a change, even if it's a change in how they feel within the first month. Losing body fat and increasing muscle mass are experienced within the first couple of months after starting the program.
I could imagine that a lot of patients mention that they're too busy to work out. What would you tell them?
Basically, eating right and working out consistently need to be the highest priority. And so one needs to look at it as exercise as being part of a standard day, as common as brushing your teeth. There is a lot to be gained from exercising right for 1 hour. It's often said that exercise is the best pill that man has ever known, as it can benefit every condition, every mental state, even depression, but not to mention the energy that it gives you back once you exercise regularly.
Quite right. So Thank you, Dr. Silvio, for this insightful explanation on Optimagenics Age Management Program, and thank you all for watching. Please visit our website below for more details and to find out whether you're the right candidate for the Optimagenics Age Management Program. Thank you.